Understanding palindromic rheumatism and remission. Imagine experiencing sudden, intense joint pain that comes and goes like a switch flipping on and off. That's what happens with palindromic rheumatism, a rare autoimmune condition where people have quick episodes of joint swelling, pain, and stiffness. These attacks usually last from a few hours up to a few days and often hit small joints like those in the hands, wrists, or knees. Between these episodes, the joints look and feel perfectly normal, with no lasting damage visible on X-rays. The number of attacks can vary a lot. Some people have several in a day, while others might go months or even years without symptoms. Palindromic rheumatism is considered a separate condition but is closely linked to rheumatoid arthritis. About half of the people diagnosed with palindromic rheumatism will eventually develop rheumatoid arthritis, which involves ongoing joint inflammation, potential joint erosion, and more persistent symptoms. Sometimes, palindromic rheumatism acts as an early warning sign or a temporary phase before full-blown rheumatoid arthritis takes hold. Scientists still aren't exactly sure what causes palindromic rheumatism. It's believed to involve immune system dysfunction, possibly with an autoimmune or allergic component. Some patients with this condition also have other autoimmune issues, like antiphospholipid syndrome, which can affect blood clotting. Because there's no single test for palindromic rheumatism, doctors relying on a detailed medical history of sudden, recurrent joint attacks that fully resolve. They also perform physical exams, blood tests to check for inflammation and autoantibodies, and imaging studies like X-rays or ultrasounds. Tests done during an attack are especially helpful because inflammation markers tend to normalize between episodes, making diagnosis tricky. Doctors also rule out other types of arthritis, especially rheumatoid arthritis, to make sure they're on the right track. Treatment focuses on reducing how often and how severe these attacks are, and on preventing the condition from progressing into rheumatoid arthritis. Non-steroidal anti-inflammatory drugs are often used during flare-ups to help relieving pain and swelling. In some cases, doctors prescribe disease-modifying drugs like hydroxychloroquine or sulfasalazine, which are also used in rheumatoid arthritis. These medications can help decrease the frequency of attacks and may lower the risk of developing persistent joint damage. Lifestyle choices matter too. Balancing activity with rest, eating a nutritious diet, and following medical advice can help manage symptoms. When it comes to remission, it means periods where symptoms disappear entirely. With palindromic rheumatism, these symptom-free intervals happen naturally, but because attacks are unpredictable, ongoing monitoring is essential. Early treatment with disease-modifying drugs can sometimes help extend these remission periods and prevent the condition from becoming chronic. It's important to remember that each person's experience is different, and managing palindromic rheumatism requires personalized care from a healthcare professional. In summary, palindromic rheumatism is an intermittent form of inflammatory arthritis marked by sudden reversible joint attacks. Between episodes, joints are usually healthy, and there's no lasting damage. It shares features with rheumatoid arthritis and can sometimes be a warning sign for it. Diagnosis involves a careful look at symptoms, blood tests, and imaging, especially during attacks. Treatment aims to control symptoms and prevent progression, with natural periods of remission occurring in many cases. Anyone experiencing these symptoms should work closely with a rheumatologist to develop a tailored management plan and ensure proper monitoring for the best possible outcome.